Hi, I'm Shiwali Mohan. I am a senior member of research staff at the Palo Alto Research Center, and today I'll be talking about our efforts on designing an interactive AI coaching system that can help people in developing behaviors like walking regularly. This was work done in collaboration with Anusha Venkatakrishnan and Andrea Hartzler. It appeared in the Transactions of Interactive Intelligence Systems in 2020. I'm very grateful that we got this opportunity to present this work at ACM IUI this year. So the main motivation behind our work is figuring out how we can use technology to support people in developing healthier lifestyles and living healthier lifestyles. Um, Unhealthy behaviors such as not exercising regularly or not eating healthier foods are associated with several chronic illnesses like diabetes and cardiovascular diseases. NSF and NIH back in 2014 designed this program called Smart and Connected Health, in which they wanted to explore how technology can be used to support people in developing healthy behaviors. One of the most impactful ways to produce behavior change is human-to-human coaching, but this is extremely expensive and not everyone can access a nutrition coach or an exercise coach who can help them figure out what are the right things for them to do so that they can live a healthier lifestyle. So our motivation was to use advances in mobile technology and advances in AI and machine learning to then develop an artificial intelligent coach that lives on your mobile phone, but it supports you in living a healthier lifestyle. And it's very exciting from an AI perspective because it requires not just the computational algorithmic parts, but it also requires us to understand what is it that leads humans to build better behaviors and how we can incorporate reasoning about that, models of human behavior into AI systems and design an effective tool. So the paper talks about two main contributions. The first one is a more computational, is how do we formulate this problem computationally? And we contextualized our research in supporting overweight sedentary individuals in regular exercise. And we wanted people to exercise at what American Heart Association would recommend, right? 30 minutes of brisk walking at least 5 times a week. And our approach is based on our learnings from human-to-human coaching scenarios. The way our AI algorithm reasons is aligned with how an expert exercise coach would reason about their trainee. And the way we have designed our models, they adapt online. So as you record what you're doing every day into your mobile phone app, it actually changes. It's personal to you. It really takes into account what your capabilities are, and it's also temporal. So as you grow in the program, as you grow in your capability, it changes your exercise schedule. And we leveraged this theory called the goal setting theory from cognitive behavioral psychology. And this suggests, this gives us some design guidelines on how we can think about specifying goals for each individual trainee. So they have 2 design guidelines. The first one is that you have to set goals that are specific and proximal. So for example, saying that, hey, you have to walk more this month, you actually have to be more specific. You have to say, hey, why don't you go for a walk tomorrow for 20 minutes and walk at brisk speed? And because this is more specific, people can actually estimate how much effort it would take to pursue that goal, and they're unlikely to postpone it. So then, having these more specific goals that the AI system helps you define, then builds that capability of exercising regularly. The second design recommendation that we follow is that you have to set up goals that are difficult but attainable, right? So instead of, so you basically, if the goals are too easy, then people get bored with them and they don't continue on with the program. But if they're too hard, then people are likely to fail at them and then not find enough motivation to pursue it. So you have to walk this fine balance, and our computational formulation is a proposal of how you can find this, fine balance when you're trying to coach somebody. All right, so just very quickly, how does the system function? On the right side, you are seeing the AI coach's beliefs about what the trainee can or cannot do. And we are using this quantity called exercise volume. So this is how much a trainee can exercise per week, right? So as the week grow, we should see some increase in trainees' capability, right? So first we designed an interface that we ask the trainee a few different questions, which helps us baseline the trainee. So how much exercise they can do even before they did the program. And all of this is just through asking them some questions, and that baselines their behavior. We already know from American Heart Association, we wanted to get the trainee to be exercising at this level. And now the goal of the AI coach is to slowly push the trainee towards this goal, right? So our paper talks into detail about how we can do that. And basically what happens is, based on certain heuristics, the AI system will propose a set of goals for the trainee to try in the first week, right? So given these set 3 different goal proposals, the trainee can pick one of them. And then that helps, set this, the slope of this function, like how much can a trainee grow in the first week. And then we make an assumption that, well, whatever the trainee grows in the first week, they are going to be growing in their aerobic capability by the same amount every week. So we fit this uniform step staircase function, and that's the first hypothesis that the agent is going to be working with. The coach then just uses some heuristic planning, heuristic scheduling algorithms to then schedule the next 7 days of goals for the trainee, right? So here we are saying that the coach wants the trainee to walk on day 2 and day 4. And then the coach would also say, like, you have to walk for 10 minutes in that session or not. The trainee can either say that they were successful in doing that exercises or not. If they were successful in doing that exercises, we ask them, like, how hard this exercise was for you. And if people did not do this exercise, we ask them, why didn't you do it, right? So we gather more information about the trainee's performance, and that really helps us revise this model, that this belief that the agent has. And by revising these beliefs, we can slowly personalize that training program to each trainee. So if the trainee says that they were successful in exercise, nothing really happens. We just keep on moving along the same program. If the trainee fails at doing an exercise that was assigned for them, we try to increase the number of opportunities they have to perform that exercise. So we really want them to get to the volume they said they would get in that specific week. But if they continuously fail, then that information that, hey, maybe the goal was too hard for them, and we want to revise and make the goal a little bit easier, to make this ramp a little bit easier. And if the trainees were successful in doing all their exercises that were recommended to them, and they said that those exercises were easy, we make this ramp a little bit harder, right? So based on what the trainee is telling us, the agent either makes the exercise schedule easier or makes it harder. And it's through those adaptations, this regression and progression, that the agent can really personalize their training schedule for each individual trainee. Right. So the second contribution that our work, that our paper talks about, is proposing this task-centric empirical evaluation. And this evaluation is very interesting from the perspective of evaluating AI systems in general. Usually AI systems are designed to have these short-term transactional behaviors, and that's what they're measured on, right? So a typical machine learning system would be measured on its prediction accuracy. But none of those evaluations actually help us tell if what we have built is actually useful for the trainee or not, and it actually produces behavior change. So a paper talks about this sort of a 4-pronged approach of evaluating an interactive AI system, right? And it's actually task focused. So it's not just us asking trainees that, hey, did you think that the exercise that was proposed to you was good for you or not? We actually measure how good those exercises were for them, and actually try to get to this more quantitative measure of the efficacy of the health coach. And we have 3 different questions that we wanted to ask with our AI evaluation. First was, does the AI system have long-term productive behavior? The second one was, we had designed these new interfaces. So we wanted to know if trainees could use this interface to provide right information to the AI system, and then if it actually matters, right? So the way we went about evaluating this was, we first just tried to see how, if we simulated different trainees into the system, what their exercise trajectory is going to be. And we find that the different trainees with different, exercise experience and different, capability growth, the coach actually does provide different personalized exercise schedules. So that's good. That means that the coach actually can adapt over a long time. Then we showed these simulations to different experts, and we tried to see if experts would agree with these recommendations. And our data tells us that yes, experts tended to agree with what the coach provides. And that gives us confidence that yes, we have not just invented any arbitrary algorithm, but this algorithm can, its reasoning is aligned with how an expert, physical therapist would think about coaching someone. The third evaluation that we did was it was about the interface and trying to see if this interface actually made sense to people. And it seems like it does. We have qualitative data that tells us that people thought it gave people a whole lot of control over what kinds of exercises they had to do. It helped them take responsibility. It gave them a whole lot of choice. And our collaborative goal setting strategy actually helped people commit to a specific goal that they could then pursue. And then finally, we deployed this agent. We conducted this ecological observational study with 21 participants, people who were managing diabetes. So these are the relevant target population. And these people installed this coach on their mobile phone and then worked with it for 6 weeks. And I'm very excited to report that people actually did manage to increase their exercise volume. There were some concerns with people being over optimistic during their self-assessment. But because we had designed this adaptive system that would revise its hypothesis about the person based on what it was observing about them, we were able to recover from those errors to some extent. And in general, people, developed some capacity to regular exercise. So all of this was exciting. And I'm personally very excited about this effort because this was not just a lab study, right? We actually had people take this and just live their regular lives. And we just observed how their behavior changed over the next 6 weeks. And the results are very promising. Anyways, thank you to my colleagues at Xerox, Kaiser Permanente, and Amazon. And finally, just brief summary of this research. We proposed a novel computational algorithm for interactive coaching. The main part of that algorithm is this parameterized model that's aligned with how experts reason, and it adapts online as it observes more information about the trainee. And then finally, the most exciting thing about this research is the ecological observational study that's not done in the labs, but with actual people living their real lives. And if you're interested about what else we're doing in health coaching, we have another paper that's coming out this year. And this one is more focused on, the work that I presented today is mostly focused on skill building or capability building. In this other work, we talk about other dimensions of health coaching. Thank you.